Can simple tamoxifen be just as good as aromatase inhibitors and anastrozole in lower risk breast cancer? Hi there, my name is Dr. Walter. I'm a naturopathic physician with a practice solely focused in cancer care for over 20 years. There was a recent paper that was published looking at the subject of tamoxifen versus the aromatase inhibitor anastrozole in lower risk breast cancer patients. These were like say stage 1 to 3, and they were actually factoring their oncotype score. So the oncotype score being is a genetic test that tries to stratify groups into the potential values of what, say, chemotherapy and endocrine treatment could do in looking at their overall survival. And in this study, they were actually looking at lower risk oncotype groups, so from 0 to 17, looking at both premenopausal and postmenopausal patients. And this is retrospective data, non-prospective, and what they basically determined in these lower risk groups from stage 1 to 3, looking at 10-year overall survival and local disease control, there was no difference. And why this is important to discuss is that side effect considerations. So for example, in the premenopausal population, they need ovarian suppression, so instant kind of chemical menopause, and which has its side effects as well in bones and other things, and then the aromatase inhibitor as on top, versus say just simply adding on tamoxifen that doesn't have those side effect concerns. So generally tamoxifen is considered an overall better tolerated drug, but it was considered inferior or not as good as an aromatase inhibitor. So now we have this paper to actually that basically mentions that that not might be true. And why I talk about this is because I'm finding I'm the only person that's talking about with patients that tamoxifen, while it's an older drug, is still can be a very good drug, and the side effect profiles tend to be, quite good overall. Yes, there are considerations. Tamoxifen, for example, has a clot risk. It can stimulate the endometrial lining, and there has been some risk with endometrial cancer. But and these are again rare things, but you always have to weigh these out with each individual patient. So anyways, this paper should get a lot more attention and hopefully get circulated in the medical community, that tamoxifen could be a valuable option in both premenopausal and postmenopausal patients who are considered lower risk breast cancer.